Hello, everybody, and welcome to this fabulous session that we've arranged for you all. Thank you, Dr. Lenny, for being a wonderful partner to us. And I'm just seeing everybody streaming to the from the waiting room into the live webinar. And of course, we are also streaming onto Facebook, and our session is also being recorded. So, Dr. Lenny, I'm going to hand over to you to start our session. Do you want to do a quick welcome and then I'll change the slides?
Thanks. Good morning, everybody. Good morning, Christina. Thanks for the opportunity to be here. This auspicious presentation of the partnership of Ignite Purpose and MLA Health Services. The launch is on an auspicious day, Nelson Mandela Day, and we would like to use that to kind of streamline the presentation to see what can be done when we work together in a community of healthcare. We can then move to the next slide. My name is Lenny Mundisani, by the way, from MLA Health, partner of Ignite Purpose. I will read the quotation from Nelson Mandela himself. What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the life we lead, close quote. This is a very powerful introductory quotation from Nelson Mandela himself on 18th of July, which is a Mandela Day globally. And we think the presentation that will unfold will actually harness the Mandela Day vision.
Thank you, Dr. Lenny. So we're going to play a video to honor Nelson Mandela, and I hope you guys enjoy it with us.
This 67-minute session pays tribute to Nelson Mandela's 67 years of public service, highlighting the resilience and wisdom he displayed throughout his life. Despite 27 years of imprisonment, Mandela's spirit remained unbroken. His journey was marked by an unwavering commitment to justice and equality, and he displayed this in his ability to be a beacon of kindness, love, and forgiveness. Mandela's wisdom guided South Africa through its darkest times, teaching us that true strength lies in compassion, forgiveness, and unity. His resilience became a beacon of hope, inspiring generations to strive for a better world. Today, we honor Mandela's legacy by addressing a new challenge, supporting the resilience of our healthcare heroes. The Global Arise Resilience Research Program, launched by Ignite Purpose South Africa and MLA Health Services, aims to enhance the mental and emotional well-being of healthcare professionals. Recent studies have revealed alarming statistics, with approximately 30% of healthcare professionals in the country experiencing symptoms of depression and anxiety due to work-related stress. 40% reporting burnout. The COVID-19 pandemic has further exacerbated these challenges, with over 50% of healthcare workers reporting increased levels of stress and emotional exhaustion. Tragically, the suicide rate among healthcare professionals is 2 to 3 times higher than the general population. The Arise Resilience Program is more crucial than ever. Together, we can build a resilient future for our healthcare heroes, honoring Mandela's legacy of wisdom and strength. Brought to you by Ignite Purpose South Africa and MLA Health Services.
I would like to introduce MLA Health Services and what we expect on the presentation. Introducing the Global Arise Resilience Research Program, impact on the healthcare sector in South Africa, engage with experts to learn about strategies and resources that support the well-being of healthcare professionals.
Wonderful. Dr. Lenny, talk to us about the joint venture.
The joint venture was a match that was bound to happen. When I was introduced to Ignite Pepper's program, I had immediate resonance with the program because it deals with the matters that we're all familiar with in the healthcare space. And I began to relate at a deeper level with the program. As a person in healthcare management and leadership, that the program speaks to us as a group, as a community. Most importantly, it trains or teaches us how to lead ourselves before we can lead others. And given the challenges that we understand, this program from Ignite Purpose resonated, and immediately we started talking about a possible venture partnership, which I'm happy to announce that partnership has reached fruition, and we are in the process of actually launching the partnership.
And this is such a lovely picture of both yourself and Teboho, who are leading the venture from your side. We're incredibly excited. Well, I'm going to introduce our managing director in South Africa, Anel Jacobs. Why the venture, Anel? Why the JV?
Hi, everybody. Thank you for joining us today. Well, I'm going to start with another famous quote of Madiba, where he says, "Vision without action is just a dream. Action without vision just passes the time, and vision with action can change the world." So from my very first encounter with Teboho, the managing director of MLA Health Services, and the phone call we had, I could clearly hear that we had a common passion of making a palpable change in the healthcare system. And we had the tools to do that. So Dr. Lenny and his son has been in the healthcare system for many years and could echo the challenges and concerns we experienced, but also the solution that we could offer, and a great partnership was born out of that. So the vision for Ignite Purpose and MLA Health Services is to put our vision into action and change the world one person at a time.
Beautiful. Thank you both. And just from a global CEO perspective, I am incredibly grateful for the opportunity to partner with MLA and Anel for you leading the journey. And I'm looking forward to working alongside Dr. Lenny and yourself, Anel, as we navigate this wonderful opportunity to make a difference to those who care for so many others and don't often get the opportunity to learn how to take care of themselves.
I agree.
I'm going to introduce our global research team, if that's all right with my fellow panelists. The research team that we appointed 18 months ago and that has grown and put together our initial research around the resilience program is myself, Elena Mullery, who is a registered nurse, trained in Scotland, works in Australia, and also currently sets up and runs a charity called Healing Hands, which sends nurses into really challenging areas around the world, and she supports them through Ignite Purpose with their resilience. We've got Tammy Oliveira, who is our global COO, but also our research and data analyst, who's analyzed our data and will keep analyzing our data and putting the information together. Dr. Kerry Thomas was one of the founding research partners with me. She has got an OBE from the UK. She's well known in starting up the Gold Standards Foundation globally, and she's very passionate about resilience in doctors. And finally, our lovely Sarah Gustado, who I call my daughter. She is beautiful. She lives in the Philippines, and of course, she's helped us as our project officer on this program. Now, Ignite Purpose is a global organization. We have offices in the United Kingdom, Philippines, Australia, Africa, Canada, and the US. There is a foundation to resilience, and I'm going to talk to you about it now. Dr. Lenny and I are going to get deep into the conversation. We're going to invite Anel in, and it's the foundations of Arise, which is the resilience research program that we're rolling out globally. I have got a fond connection with healthcare professionals. My uncle was a professor of pathology at Groote Schuur in South Africa many, many years ago. He's now retired. He's 90. But he had a conversation with me, which is where I want to start this. And he said to me that as a healthcare professional, there was always, especially a doctor, there was always this race to be the best. There was a competitive nature amongst doctors to be perfect, to be the best. And 4 years ago, when my dad passed away, and my dad was the minister and he was the doctor, he phoned me and said he'd missed out on the best parts of his life, his family. And it was hard for me to hear, because we always had such reverence for him. And shortly after that, my brother in the UK gave me a ring, and he told me of a doctor in the UK, a general practitioner, that had committed suicide in the Sainsbury's parking lot just post-COVID because she couldn't take it anymore. And it was the first time I really got to have a deeper understanding of the challenges that are facing our healthcare professionals. Mind you, I have coached so many doctors and nurses before, but never actually understood the key challenges that they faced. This gripped my heart, and I called the team together. We spoke to Dr. Kerry Thomas and we started doing the research. We wanted to find evidence that this is as big a problem as we know it is. That was 18 months ago. And today we have already presented our program to the NHS. I'm going to be in Dubai, then we're going to be in Africa. And we're in Africa right now. And I'm an African girl, so I am so privileged. The evidence speaks loud and clear to the biggest opportunity that lies ahead, and that is supporting our healthcare professionals with a program that is not how much more they can take, but it's how they can navigate their life better. Dr. Lenny, I wanted to connect this to the South African story. I wanted you to see if you could share one or two stories of why this is so important.
Thanks, Christina. I know we're talking to the experts, and what I'm going to share is something that they deal with on a daily basis. South African healthcare system focuses mainly on the public sector. It's a system where you have high patient loads, you have shortage of staff, infrastructure challenges, and the need to provide services on a daily basis. People work long shifts, get burned out. The environment engenders development of work-related stress, of anxiety, depression. And generally speaking, we deal with these things on an individual basis. And it's very difficult to actually have someone to go to when you have this overwhelming stress and burnout sensation. That community of service and community of peers is what drove me to actually partner with ARAS, because it's a safe space to communicate, to share frustrations, and generally speak to people who understand what you go through as an individual practitioner. So for the South African context, the program seeks to identify the signs and symptoms so that people can actually ask for help early. And it also gives people power to understand, to be able to lead yourself before you can lead others, because that's the only way we can actually change the paradigm. Thanks, Christine.
I love that you've shared that, Dr. Lenny. I think one of the big things we saw as we did our research program with doctors, and Dr. Lenny's now joined the cohort, which is very excited. It's exciting for me. I think the key challenge, there's a few, and I'm just going to call it out straight away. When you are a healthcare professional, firstly, the word resilience makes you want to pass out, because there is this notion that you have to be perfect. And you taught that from the beginning. And what we found is that that is stopping healthcare professionals, doctors and nurses, saying that I am struggling. Also, of course, the fear of not being able to practice medicine if by any chance the medical boards would find out that you are struggling. So it becomes a hidden secret, which is taking the lives of so many, or maybe not even taking the lives, but robbing the joy as well of just being able to love practicing medicine. One of the key things we took into account as we did this program is we used a concept from Dr. Vivek Murthy, who is the general surgeon of the US. If any of you have not come across his work, please take a look. Of course, when you join the program, you'll get to look at his work. The research he did was they went and researched what made Americans ill. I'd love to go and have that same understanding of South Africa and Australia and around the world, but I'm sure it's pretty similar because we're humans. And one of the biggest issues were that people were facing loneliness and different degrees of separation and loneliness. Initially, when we did the research to understand if this program would even be valid, we ran an interview session with med students, and it was from the UK. And one of the biggest things that they struggled with was not being able to talk about how they felt, and especially when we spoke to them about how they had navigated COVID as young interns and doctors on the hospital floor. One of the doctors said to me they just had 2 or 3 patients pass away on the ward, and they needed to get out and just go and gather themselves. Firstly, what a lonely place. Secondly, they were told to suck it up and move on, and how dare they take time off the floor. This is what creates loneliness. This is what creates separation, is firstly not being able to recognize what's going on and how to navigate. And the second challenge is, of course, not to be in a community. Dr. Lenny, one of the key things that Vivek Murthy's research has come across is that we heal when we're together. This program is so powerful because we've created communities where our healthcare professionals can come together and work together and share together so that they can heal. Heal from what? Heal from the stories that lock them into shame and fear, that get them stuck. And we're going to talk about it shortly. It's incredibly important for us to be able to address this and to support better outcomes for our healthcare professionals. I thought I'm going to address what is resilience. Now, sometimes we do a Slido and we get people to Slido share, but I know that it's not always, people don't always want to click on a QR code. But I suppose I would ask you, Dr. Lenny, and maybe Arnel, before you came across this specific work, if you had to consider what resilience meant, what would you have thought resilience meant?
Resilience would have meant the ability to withstand pressure and be able to bounce back in case you get knocked down.
Nice one. Thank you, Dr. Lenny. What about you, Arnel?
Yeah, resilience to me is also something that it's like the power that you gain from inside just to keep going, that failure is not an option, and to find ways to carry on and not to give up.
I love what you both have said, and I'm going to add an additional layer which we have introduced into this program. What we found is the bounceability of people is not as robust as it used to be. People are struggling to keep bouncing back. And we were trying to understand, why are they struggling? And even in my own story, as somebody who works in this area of working with people up to 9 hours a day, I was struggling to keep bouncing. And last night when we were talking, Dr. Lenny, myself, and Arnel, we were talking about the fragility of resilience if it's not actually connected in the right way. Many years ago, I came from investment banking. I was told that one of my colleagues had passed their sell-by date. They didn't have the ability to keep bouncing. What we've recognized is that it's not necessarily just the ability to bounce back, but it's the ability to look at my story from a place of a gift and acceptance, so that when I bounce, I'm free. Don't you love this picture? Dr. Lenny, what comes to mind when you look at
Beautiful,
this picture?
powerful.
What do you see?
It's a powerful picture. I see a man who's willing to let go and embrace the future, let go of all the trials and tribulations of professional work, of being anxious, being stressed, to an extent have mental issues, and being able to embrace that and say to yourself, how do I then embrace a positive process of healing? Firstly myself, and then to be able to heal others, letting go of shame of being inadequate, of being imperfect, and accepting all that.
Dr. Lenny, what you've just said, we're going to caption and record and play as many times as we possibly can, because that is 100% correct. When we brought the doctors into this program through the research program, the one doctor said to me, I came into this program thinking you're going to teach us another quick trick on how to be more resilient. And what you've taught us is a new way to live. Dr. Lenny, you said it very clearly. It's not about how much more we can take to keep bouncing. It's in actual fact how much we can let go of. And you've used a powerful word, shame. So I want to unpack it for everybody that's on this webinar today. Shame is the feeling that there's something about me that's not worthy of love and belonging. Shame says, I am bad. When you go through the trials and tribulations as you are a healthcare professional, healing people, working with trauma, working with disease, working with so much, working with each other, one of the biggest challenges you might face is being imperfect, which can elicit shame. Now, Dr. Lenny, when you and I spoke about this originally, we spoke a little bit about how shame and fear is sometimes so embedded in healthcare, in the way people lead, in the way people are brought up through the ranks, and that it becomes quite a tool of management in some ways to kind of teach people that this is the way to be. What do you think as I say that? I mean, have you seen that in some healthcare systems?
Look, delivery services are very stressful in a sense that there cannot be a downtime. And people tend to work long hours because of the problems that we've identified of increasing workload and shortage of staff. And when you work those kind of hours, you are not to actually break down, to be exhausted, to be fatigued, and to be able to request time out. Well, as long as there are patients to see, people are obliged to continue seeing them. And it is an environment where doctors, nurses, and allied healthcare professionals keep on going even when they have reached their limit. And it is just the way the culture is, and we're trying to strengthen the resolve of healthcare workers to be able to recognize that they have reached their limit, and be able to communicate that information to whoever is responsible, that they need time out for their own safety and the safety of patients.
And that's the key thing. How do we do it without shame? Time out.
That's correct.
So what we're going to do through this program, and what our research has shown as we've taught the doctors, is to let go, to reframe our thinking, and to set ourselves free. Dr. Lenny, you've said something a few times today. Firstly, you cannot give what you do not have. If you're trying to be a healer, you have to work on yourself to be the best doctor you can be, to lead others. Actually, anyone who's on this call that's in leadership or in organizations, or I don't care where you are as a human being, your opportunity is to work on yourself. So imagine if you could let go and be free, how much more effective are you going to be as a doctor? You know, Dr. Lenny, they did a bit of research at Harvard a while back, and they said that doctors that were able to work on their thinking patterns and to be more peaceful and in the moment were able to diagnose 30 times more effective. So their ability to be able to be peaceful and calm and wise in moments helped them be better doctors. That's not even telling them how much more it's going to be as they navigate their life. when I presented our program to the NHS a while back, actually a month ago, there was another doctor presenting on resilience, and she was beautiful, and she was saying how we can bounce back. As I've already said, the key element to this program is not just about bouncing, but it's about having a look at your personal growth as you're doing that, because you're looking at your life as an opportunity and you are learning how to embrace the moments of growth that you've gone through. One of the biggest things in this work that we're doing, Dr. Lenny, that you've been involved with, is we're actually wanting to support our healthcare professionals with the adaptability required to navigate, to think differently about how to solve problems with patients, to really use all their neural pathways, to work on that inner strength. I call that filling ourselves up from the inside. And I want to stop on this. There is a doctor in Canada by the name of Dr. Gabor Mate. Have both of you heard of him? Possibly? No?
No, I haven't.
Oh, Dr. Lenny, we're going to have so much fun. Dr. Gabor Mate is a physician, and one of the things he talks about is, of course, that inner strength and inner healing. And he is a self-proclaimed workaholic, which I think how many doctors on this call are workaholics. My uncle in Cape Town, he started a pathology practice at the age of 75 because he just couldn't stop now. That's not a surprise, right? I know I suffer from that gift as well. The challenge is when we have got to, we're running towards our worth consistently, we are not filling our own tank. That inner strength that's required for us to truly be peaceful and in the moment is a shift in thinking and practice, which then helps us with emotional regulation and stress management. So I've got to say I'm a work in progress. I'd like to say I'm fully cured, but no, it's taken me almost 50 years to be who I am. It's the journey. This is what I've just been speaking about: adaptability, resourcefulness, inner strength, stress management, and emotional regulation. Dr. Lenny, which ones do you like most, or do you like them all?
Adaptability.
Adaptability.
Because the environment is always fluid. No day is the same as the previous day. One needs to be more adaptable to the current situation on a daily basis. It's a very fluid environment where the number of patients change on a daily basis. We need to be able to adapt. The other parts of the ARISE program are important, but adaptability for me would be the main thing, that you are able to adapt to the environment.
I love that you've said that. And then I'm going to go back to that picture I showed you with the man and his arms wide open. Our lack of ability to adapt is because sometimes we're holding on to things that stop us from being able to adapt. And the opportunity we create with this program is to teach people how to let go. How beautiful is that?
Absolutely.
Now, in the demanding world of healthcare, I'm going to play a short video that we've created for everyone that's dialed in, just to have a good understanding of some of the research. Now, if you dialed in and you sat in the waiting room, you would have seen the amazing research we've done around why resilience in South Africa is important. But I want to play this quick video for you just to get a good idea of the ARISE program.
Resilience is not just an advantage, it's a lifeline. Healthcare professionals operate in high-stress environments, often making life and death decisions under immense pressure. This constant stress can take a toll on their mental and physical health. Interacting with patients who are suffering, delivering difficult news, and managing the outcomes of medical procedures add emotional strain. Emotional resilience is vital to prevent burnout and maintain compassion. Long working hours and demanding schedules lead to physical exhaustion and mental fatigue. Burnout, characterized by emotional exhaustion, depersonalization, and a sense of reduced accomplishment, is a significant risk. Building resilience is crucial for long-term career satisfaction and quality patient care. Resilient professionals provide higher quality care. They are more focused, empathetic, and better equipped to handle patient care complexities. The ARISE Resilience Program is designed to address these critical needs. ARISE offers training in stress management techniques such as mindfulness, meditation, and relaxation exercises. These practices help healthcare professionals manage stress effectively.
The program includes strategies for emotional regulation, enabling professionals to handle emotional aspects of their job with composure and compassion. Recognizing the importance of physical health, Arise promotes regular exercise, proper nutrition, and adequate sleep to enhance physical well-being. Arise teaches time management techniques to help balance workload and personal life, reducing burnout risk and enhancing overall life satisfaction. A supportive community is fostered through Arise, providing peer support, shared experiences, and a sense of belonging that is crucial for resilience. The program encourages continuous personal and professional development with workshops, coaching, and tailored resources, helping professionals adapt and stay resilient. By addressing these critical areas, the Arise Resilience Program empowers healthcare professionals to maintain their well-being, deliver better patient care, and thrive in their demanding roles. Embrace resilience with Arise. Dr. Lenny, what did you think of that video?
It's an amazing video that actually captures the essence of healthcare delivery, the environment that the professionals are exposed to on a daily basis. No clinical case is exactly the same. You've got to be on your feet, thinking, acting, improvising. And it really captures that in a very succinct manner. Thanks.
No, it's my absolute pleasure. I know that Anel, when we started talking about Arise, you did so much research because you've got such compassion for nurses. And I was wondering if you would give us an idea of why you believe South Africa needs Arise.
Well, I can talk all day about this, but I've got 3 key points, and the video that you've just shown actually just confirms the 3 key points that I feel that nurses need. So it's important for all workers in every field, but especially for nurses, because they're taking care of others. So the first point I would say is the self-care, which goes back to our inner strength too. I think change starts with self. So self-care will reduce stress. It replenishes the nurse capacity to provide compassion and empathy, and help to improve the quality of care. Like in the introduction video you showed, 70% of nurses during and after the pandemic actually said that they had put their health, safety, and wellness of their patients before their own. So there you can already see the problem starting, because they forget they need to fill their tanks. Then the second one to me is mindfulness-based practices that we now offer. And this involves the practice of paying attention to the present moment with a non-judgmental attitude. I think the non-judgmental attitude refers to the shame that people will feel. And this practice also reduces the symptoms of burnout and improves job satisfaction. And then the last thing that I think this program and what we are trying to accomplish is professional and personal growth. So by prioritizing the mental health of our nurses, we improve the moral respect that nurses extend to all other human beings. We improve patient care, promote workplace health and safety, and we preserve the character and the integrity of what this profession holds. Like I've always said, like a pastor, a doctor, a nurse, I don't feel this is a job, it's a calling. So they can maintain their competence and improve the overall quality of our healthcare system. So I think self-care, mindfulness practice, professional and personal growth. Those are the 3 things that I think our nurses really need.
Thank you, Anel. Dr. Lenny.
What is critical for nurses, but it's also the same for doctors and allied professionals. South Africa needs this program, as the problems we've highlighted indicate that you need professionals that provide the service that are mindful,
Yeah.
that accept vulnerability. We are not superhumans. We should be able to accept our vulnerabilities and learn from those and seek help when needed. The vulnerability issue, we get taught that we doctors, we shouldn't complain, we shouldn't. A situation where people feel so alone in their own situation, they are exhausted, but they are taught not to complain or to actually ask for help. And this leads to all these problems of burnout and mental stress, which is endemic in our environment. So the program will train ourselves to understand that we are human beings that need to keep replenishing the cup.
I love that you said that. Keep going.
No, I was saying that's really for me the need in healthcare in South Africa ourselves, that we are normal human beings who work in a specific environment, that unless we are well, we cannot make other people well. We need to start with self-care, as Anel said, but and develop neuroplasticity and coping mechanisms to continue going and providing all the healthcare that is necessary. Thanks.
Thank you, Dr. Lenny. Well said. We set out in this work and this research program to teach doctors how to rewire their thinking. And it's been a great passion of mine, because I will use a quick example. About 5 years ago, my son was suicidal, and he wouldn't go to school. We ended up going to a family therapist. They do that here in Australia, by the way. If your child doesn't want to go to school, they send you to the government therapy. And we sat there, and I had a moment where I let all my anxiety and stress out. And the therapist phoned me afterwards and said, you know, you cannot have your son be better until you're better. It challenged me to do the work. And so the work we're teaching is not only research-based, but I live it, because I believe you can't give what you don't have. You got to do the work first. And it's transformed my son's life. He now works with us in our practice. He recruits doctors. How exciting, for our rural country. And there's an opportunity to be better because I'm better. I make my world better. Now, would it be okay if I share some research outcomes with the fabulous people that have joined our webinar?
Absolutely.
Of course.
Fantastic. Now, when we sought out to do this program, we're going to use a clinical tool that's clinically recognized globally to measure resilience. Now, this tool, a university in the US and Jonathan Davison gave us the rights to use this program. So it's the Connor Davison Resilience Scale. So what we're going to do as we go into this program, we're actually going to keep researching. So all the doctors that will go through this program in South Africa, you're going to go first, because this program is coming to you first before it's even going to some of the other places. And you're going to be part of this global research study, which is thrilling. The other part that I think is amazing is that as you go through this program, you can measure your resilience as many times as you like. Now, of course, we say measured beginning, during, and after, because that helps you see what the measure looks like and how you're feeling when you're doing the measurement. Now, as we did the research study, we recognized that globally, this was how we were kind of pegging some of the stresses for healthcare professionals and a lot of doctors. The lack of support, 10%. Dr. Lenny, you've spoken about that. Long working hours, you've spoken about that too. How many hours sometimes do you have to work on the round, Dr. Lenny? Over 30 hours?
Over 30 hours at a stretch.
Okay, and that's not healthy. High patient. Keep going.
Yeah, the body gives up after a certain time. And I know we're more resilient than we think, but at some point the body will tell you that you've done enough. You need to rest, and And unfortunately, sometimes we don't have that time out. But yes, 30 hours at a stretch it's a lot.
It is a lot. And if you think about police, and they only go 12 hours. So there's a great challenge here. The other thing we saw was the high patient loads, which we know in the public sector is huge. Emotional stress, 20%, administrative burdens. In Australia, the research they did was they were saying for every day that a doctor practices and sees his patients, he's spending another 2 hours doing admin. So high administration loads. We're so thrilled because we know this program works. I like evidence-based. Do you like evidence-based, Dr. Lenny? I love it.
Of course,
Over 10
evidence
evidence
is what we do.
Evidence is what we do. It's science, right? So we could see a shift in the resilience of people that were going through the program, beginning and after, a shift of 11.29 points, which is massive because this is after 10 weeks. But we wanted to also hear what people said. Now, based on what they said throughout the program, here are some of the key themes that the doctors and the nurses and med students walked away with. The first one was their ability to adapt to change, that flexibility, that agility that's required. That was one of the biggest things that came out. Their positive perspective. Through this work and the neuroplasticity we take them through, their ability to reframe and to shift their perspective has been powerful, not just in work, but in their personal lives. Because what we found is a lot of doctors take a lot of stress home. A lot of nurses take a lot of stress home. And so we needed to help them short circuit that and shift their thinking, which leads me to this mindfulness and reframing techniques, even with difficult patients or difficult colleagues, how to reframe how they were actually seeing and communicating the challenge, which leads me to obviously dealing with challenges. And one of the biggest things which we, and Dr. Lenny, you and I spoke about this, is this terminology of acceptance, how to get doctors through the space where we are accepting and understanding that acceptance creates freedom, but how to do that in a positive way that's not apathetic or giving up. And that really shifts us into a growth mindset. Dr. Lenny, you and Arnel have both spoken about community and vulnerability. And one of the biggest things we teach is the power of vulnerability, because our aim globally is to reduce the stigma of vulnerability and to shift shame. Because if we can do that, can you imagine the robust health care professionals and health systems we're going to have across the world? And then finally is the power of connection, which I think harnesses the strength of this resilience program.
The Arise.
Now, we do want to open for questions too, because we want to give some books away. How exciting, the Glass Angel book. And maybe for those of you who really want to have a coffee with me when I'm with Dr. Lenny in 2 weeks' time, to reach out, because we obviously want to catch up with you. But what I'm going to do is I wanted the doctors to be able to share their journey in their own words. And what we did was we put it together in a video, which we want to share with you today, because I think it's better to hear it from the horse's mouth, don't you?
Absolutely.
Resilient Research Programme has profoundly impacted its participants, offering tools for personal and professional growth.
Making strides one at a time. The biggest contribution has been self-reflection among a peer group with common challenges. It's made me calmer and more accepting. The program has helped me address patient concerns in a more patient-centric way, making the journey more graceful.
This course has transformed how I receive feedback, encouraging me to embrace vulnerability and be less defensive. It has sparked a deep interest in resilience and change adaptation, enriching my personal and professional development. The skills I've learned have also improved my work-life balance.
I started the program at a time when I was looking to improve my work-life balance. The lessons I learned helped me to approach problems with a broader perspective, resulting in greater empathy and improved communication with my patients. This has made my work more satisfying and enjoyable.
The program has sharpened my awareness of reflex thoughts and their associated emotions, helping me manage stress and interact with patients more effectively. I've become more receptive to criticism, using it constructively to foster my growth.
The course has equipped me to handle stress more effectively,
leading to better decision-making and more productive handling of difficult situations. Living the concepts taught in the program has the potential to positively impact those around me, fostering mindful, compassionate communities.
The Resilience program has supported my ability to manage stress effectively. It has taught me to transform my vulnerabilities into strengths, enhancing my well-being. The supportive community has been invaluable, making me realize I am not alone.
Join a community of healthcare professionals dedicated to growth and resilience. Enroll in the Arise Resilient Research Program today. Visit website to learn more and sign up.
Now,
Beautiful.
thank you. Dr. Lenny, what do you think of those testimonials from some of those doctors?
Significant responses from the program itself, the positive impact the program has had on everybody that participated in it. These are actual testimonies of doctors who were on the cohort. All of them report positive outcomes in terms of their resilience and how they are able to rebound from the daily stresses of the work.
Absolutely. And of course, post this launch webinar, we will make available the research, the program overview, and the link to this video so that you can send it to as many of your colleagues as possible to embrace the change. Now, of course, what I'd love to do is we've got some time and we want to obviously give some gifts away. I love giving gifts away. Isn't that nice? Do you like receiving them?
Yes.
Always.
I'm going to bring you Vegemite and Tim Tams from Australia, Dr. Lenny. But the key, and by the way, for everyone out there, I'm an African girl. I was born in Port Elizabeth, and I'm also Indigenous. So I'm really proud to say that I've got mixed heritage, and it makes me incredibly proud. I learned all about being Indigenous when I came to Australia. Now, that's besides the point. What I would like to share with everybody is we want you to ask us some questions. Now, you should be able to ask some questions through the chat window, which we're hoping that you can try out. Let me just make sure that everyone can. Everyone, I'm putting it on everyone. So I would love for you to please drop a question in please, into the chat box, because we would like to field any questions that you might have about the program, about the research, about anything that might be in your minds right now. Because for those of you who ask us some questions, we're going to give you some beautiful gifts. So we would really like, don't just ask a funny question. I mean, ask a funny question if you want to. But Dr. Lenny, myself, and Anel would love to have you engage with us in a few questions. Now I'm waiting very patiently, and I'm hoping that, it would help if I opened the Q&A, wouldn't it? Madeleine Pretorius, when will this program kick off for all hospitals in South Africa? Well, that's a big question, Madeleine. Our job, of course, is to introduce this to as many hospitals as possible. Dr. Lenny, would you like to share any insights in some of the hospitals that might potentially be there's lots of questions coming through now.
The short answer is that the program should start within a couple of weeks. We're ready to actually start. This is the official launch, and we will be engaging individual hospitals and individual groups and actual individuals who want to join the program. We are ready. We can go onto the website. Thanks.
Thank you very much. And we've got another question from...
Can I just add onto Dr. Lenny as well? And we have beautiful facilitators in South Africa. I just have to put it out there, that is ready to teach and connect with you. So yes, as soon as doctors and nurses sign up for this project, we are ready and able.
Now, someone's asked here, now, Dr. Lenny, please help me pronounce our lovely participant's name. Mfele Kezendenzi. Did I say that okay?
Pele Gedzeni.
Thank you, Dr. Lenny. I'm going to...
Pele Gedzeni Malawi. Good morning, Prof.
So,
Professor.
Professor would like to know how long is the program? So the program spans over a 10-week period. Do not worry, it's not going to be every day. Throughout the program, it's probably about 15 minutes a day that the doctor will spend on the app on their own, or they can kind of smash it in one go if they really want to. And then they're going to spend an hour to an hour and a half a week with a cohort of peers being coached and running through the reflections of their week. Prof, when we did this, I thought, oh my goodness, we're going to lose doctors halfway through the program. We didn't lose one, because we've designed this specifically with scientific understanding of the concept and then connection to the workplace and the challenges you experience as a doctor, and then reflection work for yourself. So we have, and then of course, post the program, each doctor or nurse or healthcare professional is invited to stay in a group catch-up once a month to still feel part of that community. So I hope I explained that well enough. So it's over 10 weeks. And then there's, of course, ongoing stuff. And of course, you have access for the app for a lifetime. So you don't get switched off. You can keep going back and re-looking and revisiting the concepts. Thank you, Prof. Liesl Visser asked, do you take big groups? Yes, we do. So we can get up to 25 people in a session with 2 facilitators. And it just depends on the group size that we want to run. Thank you, Prof. We've made sure that this is so doable and
Yes.
and easy to use. Liesl, I hope I answered your question. Tembani, so Liesl, you're going to get a gift. Prof, you're going to get a gift. We're going to make sure you've got that gift in your hand in the next 2 weeks. Tembani, you've said here, this is beautiful, a perfect response to our most crucial sector in South Africa. My personal experience with healthcare professionals is that they don't always know how to include and prioritize personal and professional growth and the regulation into the off-the-clock time. Dr. Lenny and other colleagues here, what can we say to South African healthcare professionals to ensure they prioritize this call to action on self?
I think that's really the essence of the course, to prioritize oneself. I know it's cliched. If your cup is not full, you can't give anything. And the healthcare professionals, I not generally speak about doctors, but it applies to all healthcare professionals, nurses, allies, that they wake up every morning to go and make people well.
Yes.
And for you to do that, you need to be healthy yourself, mentally, physically, psychologically. And this course actually helps to prioritize the healthcare professionals in terms of their mental and physical health. And I agree with the comment. We generally don't prioritize our healthcare because we get taught that we should just make everybody else healthy.
Yeah, 100%. And this is going to teach you to take care of yourself.
Absolutely. And to feel energized again. I think the energy that we expect from our doctors and nurses, from a patient side, I think they are just human. As Dr. Lenny said, they are all just human. And we look at them as superhumans that can't get sick, that can't get irritated, that can't get annoyed. So yes, and this program will help them get up in the morning, feel energized, to go and do their calling.
Absolutely, Arnell. And we've just had a fantastic question come up from Nondi. Nondi and Lalani. Oh, so many people are going to get gifts. I'm so excited. Here's the question. How does this program cater for those healthcare professionals who are based in conflict zones and who would benefit so much from the program? Londi,
Oh, so good.
it's a great question. At the moment, my research colleague Elena is actually working with some healthcare professionals that we're working with before they go into the conflict zone. So if we can get to them before the conflict zone and support them with some of these skills, that would be amazing. If they are in the conflict zone, we can tailor the elements to this program to help them. Because it is app-based, we can actually, hopefully they've got Wi-Fi. If they don't have Wi-Fi, let me tell you, we will make it work. There must be a space in order to have some downloadable capabilities that they must be able to use. We will make it work for them. The key thing, of course, is to work with a team, our team, to be able to still catch up with them and support them. So it just depends how we customize and tailor that program if they're in conflict zones. But we're currently doing that with some nurses that we're sending into really troubled areas across the world. And I'm pleased to say that it's working well, the way we've set up the program. So, Londi, I don't know if that answers your question, but I'm one of those people who will find a way to help the people that need the help. And we will tailor the program if they can't actually get to it. But as I said, either before or after. Thank you, Londi. Come on. We have got 7 minutes. I have got my timer because we're doing 7 minutes as an honor to President Mandela. So I would like a few other questions. Come on, there must be some more questions burning for people as they are considering how would this program possibly work in their hospital or for themselves.
There's another question, Christina.
Can you come and train on site?
Come and train on site?
Liesl, absolutely we can.
Absolutely.
We can come train on site. We can break the program into a face-to-face program. The key thing with the program, though, is to do the work. The reason why we've split it over 10 weeks is to get the behavior change and to get people into a practice of working in their mental thinking and to do the neuroplasticity work. We can, of course, break it into sections and come and deliver work and then get them to do some work before we come back again. The coming back is the key part around behavior change, which we want to do, and also the practices. What we did with some doctors, which we took on a wellness day, we supported an organization that did it here, which is like a primary health support organization. We actually got doctors, we taught them how to journal, we taught them how to do reflections, we taught them how to connect back to their roots, back to the indigenous roots in the country. It was just beautiful. So Liesl, whatever we've got to do to support that fits with your team, we will be able to do that, no problem. Any other questions? Come on, we've got 4 minutes to go. Dr. Lenny, was there any questions that people have come up with while you've been speaking to them about the program or about how it might work?
Generally the same questions that have been put to us in terms of the modality of delivering the program and how many people we can take at a time, whether we can come to site. So yeah, basically I get a sense that there is a definite need in the market in the environment for this type of program. People are battling with all these issues as individuals. I think the biggest advantage of the program is to actually have a community of healthcare professionals that can interact with one another at the local level and even globally, as it is a global program. The problems of healthcare seem to be similar across all of the globe. And it's good to actually, if you're on the program, you are part of that community, you can share problems and solutions.
100%. So next week I fly to Dubai and I'm going to be speaking and sharing this program at a conference in Dubai with hospital leaders from across the world joining. We're back in the UK again, speaking to the NHS and the commissioning teams on the 2nd of October. We are not stopping. This is a calling point for us to make a difference to healthcare professionals across the world. And that's why this is amazing to see that Dr. Lenny is joining us. I think when we've spoken to policymakers here in Australia, one of the key things is everyone's saying there's a problem, but no one's willing to address the problem with positive action. And what we're intending to do is to make it bite-sized, easy to use, a community sense, enough information to make people not feel that it's like a bit of a airy-fairy program. It's based in science and research. It's measurable and it's outcome-based. So if your hospital is investing, you will get an outcome-based report from the program, obviously not individuals' names, but we'll be able to measure the outcomes of the program, which should you take that to your board and to your shareholders, it is an outcome-based program that can actually prove that there is a significant shift in the way your doctors are engaging with resilience, which I think for a CFO or for a board, it's really important to be able to note that there's an investment and a return on the investment. That's just the hardline stuff. What we've seen is a significant shift in how people are living, spending time with their families, enjoying their life. And I think that in itself is totally amazing.
I also think it's important to mention, Christina, that this is not just a program that will come and deliver and then walk away. We will hold your hand and come back and build a relationship with you, that connection with you. So it's not coming in, teaching you something, and then walking away. Therefore, the app is a lifetime app that will keep on updating. They can keep referring back to their facilitators. So it's important for them to know that this will be building a relationship with everybody in the cohorts.
Now, we have got exactly 20 seconds left, and then we've done our 67 minutes. Dr. Lenny, in closing, what would you like to share with everyone that's joined?
I'd like to thank everybody for joining in the first place, but also hopefully the contribution we are making to the community will make sense to the doctors and the nurses and the allied healthcare professionals to join us to fill the void, because the real problem is we wake up every morning, go back, but our cups are half full.
Empty.
The program will actually help all of us together. I'm still I'm healthcare worker myself. I still see patients actually. So all these problems that we experience, I experience them too. That's why this program resonates with me so much. Thank you.
Thank you, Dr. Lenny. Thank you for everyone that dialed in. We cannot wait to meet you and to bring this program to you and to your teams. Anel, thank you for leading this and for being our partner on the ground in South Africa. And to everyone in South Africa, I'll see you soon. Thank you so much. Take care and have a beautiful evening, Dr. Lenny.
Thank you. Good evening.
Thank you, Dr.
Take care,
Lenny. Thank you,
everybody.
Christina.
Bye.
Thanks, Anel. Bye.